Hey everybody, thanks for checking this out. My name is Jay Wyke. I'm a professor at the University of Toledo, and I'm also the director of the University of Toledo Mindfulness and Creativity Initiative. We've got a lot of work that's happened under the scenes to get this club existing on the medical campus, and I am so psyched that it's happening. Come in, check it out, you're gonna love it. We're gonna discuss how to do meditation practice. You'll have a chance to meet with your peers and connect, help deal with stress. It's gonna be wonderful. And right now, I'd like you to say hello and meet some of the other folks that are directing this and actually running the show.
Hey guys, my name is Tamara Panarjian. I'm president of Student Health and Wellness Club, and I will be one of the facilitators for our mindfulness meditation sessions, and I'm really excited to bring meditation to UTCOM.
Hi guys, I'm Natalie Siriani. I'm the president of Complementary Medicine Club, and I'm excited to be working with the Student Health and Wellness Club to bring the meditation workshops to you, and I look forward to seeing you every week.
Hey guys, my name's Ali Kovacevic. I'm a second-year medical student, and I'm going to be another one of the facilitators this year. Excited to get this all going.
Hey everyone, Julie Lambert. Excited to do meditation with you all.
Hi, I'm Heather Voss-Hoynes, and I am also going to be a facilitator this year, and I'm excited to help everyone out.
Hey everybody, welcome to this video. We're gonna have fun here. What we're gonna do today in this video is get clear about what mindful meditation practice actually is and how it works and how to do this thing, see? And the hope is that before you come out to one of the experiences that we hold every week at campus, you'll have watched this, and so you kind of have a heads up and know what you're doing, right? So the first thing is this. A lot of people feel that what meditation must be or is a kind of a battle of the mind where our object here is to shut the mind off, okay? So we think, okay, I'm going to take my mind somehow and drill it into my mind somehow and shut off all thinking. And this is, if you could do that, that would result in something like a blackout, or maybe a really deep trance, or maybe the kind of consciousness we experience at night when we go into a really deep, dreamless sleep. But the fact is that if we were able to pull this off somehow, it wouldn't actually help us in our daily life at all. It actually wouldn't help us deal with the stresses of being a student or being a physician or dealing with just living a life in general, actually. Instead, what it would do is it would train us to go into a disassociative escapism. So we're going to use our meditation to kind of get away from everything and kind of go into this blackout space. Now, if you get into a trance like that or something, it's true that in that particular moment there's no suffering and there's no pain because there's very little consciousness. But when you come out of the blackout or the trance or whatever that would be, everything is still stressful. You know, that exam is still before you. But the problem is that now your skin is maybe a little bit thinner because you've escaped rather than dealt with it. So we don't want to do that, interestingly enough. The object of what we're doing here is not to shut the mind off or stop all thinking or anything like that. The more common misperception is that people think that mindfulness meditation is about creating a happy mental environment, right? So maybe we're going to close our eyes and we're going to imagine, waterfalls and pretty clouds and maybe some unicorns and a Smurf or two, some kitties, a pug, and we're going to have a really nice mental landscape to inhabit. Now, if you do that kind of thing, in fact, blood pressure will drop, stress will release, but that's happening because, again, we're escaping the situation. So rather than actually being involved in the situation, we're actually creating a mental landscape out here somewhere and escaping into it. So when we come out of the waterfall imagery and other stuff, the exam is still there, right? And the skin is just a little thinner about it because we haven't been dealing with it. So it doesn't help. And this transfers directly to your experience when you're encountering patients. Your patients need you to be there with them. This is a very intense moment in their lives, perhaps, right? And if you are practiced at escaping, you're going to be less able to actually meet that person and their family than if you're actually practiced in being fully present, which, as it turns out, is what mindfulness is all about. So rather than trying to shut the mind off and go into a blackout, or trying to cultivate an internal happy place and escape there somewhere, rather what we're doing is we're learning to and practicing the skill of being able to be powerfully present in this very moment as this moment actually is. And that's what we mean when we say be mindful. It means be aware of this moment. So some people might think, well, that's crazy. Of course I'm in the moment. Where else would I be? You can very easily not be in the moment that you're in, right? It's all too common that your face is forward and your body is present, but your mind is completely elsewhere. At least it is for many of us, if not you. So let's be aware of that and let's work with it together. So here's the way that we do this. We need to talk about what we do with the body. We need to talk about what we do with the breath. And we need to talk about what we do with the mind and the practice itself. Now we're going to pause this for a minute and we're going to do some videos here about different postures that work. We'll begin there. So when you approach the cushion, you want to go ahead and sit down comfortably. And the first thing we do is our feet are on the floor. We take our right hand and reach over and grab the left toe and pull it over so the leg is cozy. And then we do the same on the other side. And initially what we want to do is put both feet so they're on the cushion. This is called Burmese. Now once you've got that together, you want to scooch forward on your knees and grab the cushion and adjust it so that you're sitting on the forward third of the cushion. The next posture is we take the foot and bring it up and let it rest on the leg like so. This narrows the girth a little bit and therefore is kind of nice, but it might make a little stretch on the leg. The next posture is called half lotus. And in this one, we'll take that foot and actually bring it all the way up and adjust again. Now as you do these, you might need to reach around and make sure that the cushion is set correctly. For each one of these postures, you want to make sure that if you choose them, you alternate which leg is on top each time you sit, because they're asymmetrical and you don't want to introduce a chronic asymmetry into the structure. Another choice you can make is to take your cushion and go down to a kneeling position. You scooch the cushion so it's in between and comfortable somewhere, and then you let your weight settle on it like so. It's important with any of these postures that you sit in a way that's comfortable for your body and you're not causing any stress or discomfort when you begin your meditation practice. Another good choice is to use a chair. When sitting in a Western chair, it's important to make sure that you do not lean back on it, like so. This will end up being very distracting for you and all your friends, and not be conductive to correct concentration. Instead, you want your spine to be straight, you'd like your feet to be flat, and so that you have your own resilience and your own posture and presence with your spine clean and straight. So now that we've looked at different things that we can choose to do with the body in terms of the leg posture, the next is what we do with our hands. So in mindful practice, in this tradition, what we do is keep our dominant hand, the hands you write with and stuff, that goes underneath. The other hand nests on top such that the middle fingers are connected to each other and aligned like so. And then your thumbs come around and connect on top so that your thumb is right over where your middle finger is. And they touch like so. This hand posture is very important. And it's important because it helps us keep the correct frame of mind. See, the mind and the body are not just connected, they're united. And in this way, I've got a good feedback system to know that I'm actually in correct posture and in correct mental state. If I'm in my meditation practice and I start to collapse into sleep, then the hand posture will collapse into sleep too. If on the other hand I start to drift off into dreams or whatever, then the hand position will open up and space out just like I am. So we want to make sure that the hand posture is kept precise. This is an active stance. This is not a passive body position. We're holding ourselves very precisely and very clearly, and the hand posture is important. Just to say it, there are other hand postures associated with other meditational techniques. They all do great. They do exactly what they say they do. This one is particularly useful for the practice that we're engaged in here, being present in this moment, right here, right now. Now further, you want to make sure that your nose is aligned with your belly button and that your ears are aligned with your shoulders. The breathing is done through the nose. If you can, you take your tongue and put it forward and behind the teeth and bring up a little suction in the mouth so that you're not salivating and this the whole time you practice. We want to keep the eyes open, but we have the eyes lowered so that a couple of feet in front of us on the floor somewhere, there's a little point, and we let our eyes rest on that point. We don't just drill into that spot on the floor in some kind of a hard way. We let the gaze rest there and then let the peripheral vision stay open and aware of what's going on in the environment. This is important because the mindfulness practice that we're doing needs to apply as you take the exam, as you're doing that interview with the patient, as you're executing that medical technique. It's not something that we do afterwards to decompress or before to kind of settle in. It's something that we actually do in the moment. So in that case, it would be a mindful conversation, right? Or mindful whatever we're doing at the moment. So keeping the eyes open is really important for that. I think that's all for the posture. Now we'll talk together about what we do with the breath. So in mindfulness of breath practice, what we find is that most people are in fact breathing up here most of the time. Most folks are like, and it's all up here, and it's almost a pant, really. It's the energy of the body is up, the felt sensation in the body is up. Most of the time, most of us are back here behind our eyeballs in our awareness, and the breathing is kind of hovering up here too. And if you notice yourself when you're stressed, your energy is up. And what tends to happen is we're not grounded, our energy comes up, and we flight mechanism by going this way, up and away, or we freeze by just going up and here, and we get stuck, or we get aggressive by going up and at. So either way, what happens is instead of responding to the situation, we're reacting, and the precursor to the reaction is usually the energy comes up, and then either goes away, freezes, or attacks, right? So in contrast to that, what we're doing is we're practicing being in a very stable, rooted place and way in the body, right? And we're bringing our awareness and our breath down to the root. And in this way, we're practicing being grounded in the present. So therefore, when we breathe, we want to make sure that we're breathing down as low as we can in the belly. Now, it's important that we don't spend our meditation time trying to manage the breath. The expectation is not that you're sitting there like forcing your breath to be particularly long or artificially, deep or something like this. You let the breath breathe itself, right? And you prefer that the breath is rooted in the belly, such that on the inhale, the belly comes out, and on the exhale, the belly comes in, as though there were a balloon down here, and it's the inflation of the balloon that draws the breath down, and it's the balloon's collapse that has the breath come out. Now, the last part that we need to talk about, and perhaps the most important, is what we do with the mind, what we do with our concentration. Given that we've selected a posture for the body that is comfortable, that is not hurting or causing harm. There's no virtue in ratcheting yourself up to some unsustainable posture. Sit comfortably, but correctly. And given that we're breathing and from a rooted place, deep in the body, then we now talk about what to do with our concentration. So the practice here, the practice I'd like to offer everyone, is the practice of counting the breaths. So your practice is counting your breaths. And the way we do this is, we hold our posture correctly, we breathe correctly from down low, and as you inhale, you mentally sound the number 1. And as you exhale, you mentally sound the number 2. We inhale again, we mentally sound the number 3, and predictably we exhale 4, and like this. And we continue on until we get to 10. Once you arrive at 10, then you start over and start with the first breath again, counting 1. So it's a matter of being in the body, keeping your awareness with the breath, and using the counting to make sure that you're staying in place. The counting has the benefit of letting us know when we start to drift off into a collapsed place or drift up into an expansive dream space, because you'll find suddenly you haven't counted anything, or maybe you're at 15. Okay, so it's a feedback practice. Now, with that, there's an important sort of distinction, okay? As you practice, your mind will continue to be a mind, which is a good thing, all right? So you'll hear sounds, you'll perceive visual images, you'll feel sensations in the body, feelings will rise and fade, and also thoughts will rise and fade. None of this is any problem, okay? We do not need to go outside and stop all the traffic so that we can meditate. We do not need to make all the dogs quit barking so that we can meditate. We can practice with traffic and pooches doing what they do, being cars and being dogs. And in the same way, internally, you do not need to make an enemy of the mind or the body. But what we do need to do is be aware of how we're wielding it. So, as I sit, counting the breaths, sounds will be heard, thoughts will be felt and perceived. Our practice is simply to stay with the breath in the midst of those thoughts. If and when you get hooked by a thought and it pulls you around such that your awareness leaves the center and goes up into the thought, then what we want to do is see the thought, acknowledge the thought, and let it go. And then simply, but precisely, bring your awareness back to your root and back to the breath. This is a very important point. Many students, when they begin practice, one of the first things to learn is the difference between having thoughts flow through the mind and to be hooked by the thoughts. So, for example, if I'm sitting here, I breathe in 1, and then I breathe out 2, and then I think, oh, this is wonderful. I'm so glad I'm doing this. This is absolutely fantastic. I'm great at this. I got this down, right? Then I've mentally jumped on the horse and getting taken for a little ride here. Now there's a moment before where I'm just pulled along by the story and I don't even notice. And then there's a moment where I notice that I'm not following my breaths at all. I'm thinking about how awesome I am. Or maybe I'll never do this, I can't do this right, I don't know what I'm doing, I never do things right, here I am again. That's just another story, right? So what we want to do is make sure that whether the story's happy or sad or neutral, let the story be the story, but we keep our awareness in the breath. So, see the thought, acknowledge it, let it go, and come back into the moment. That's it. It's not complicated, but the benefits of doing this are really incalculable. To train the mind, to learn how to wield it so that you can be fully present and you can put your mind where you want it to be for as long as you choose for it to be there, is amongst the greatest skills any of us can have. So please take it up, and use it well.